high risk for complications and should not be fasting. When it comes to type 2 diabetic patients, we can divide them into three categories. The first is those patients who are diagnosed with diabetes, but they are still not on any medications and they are only diet controlled. These patients can generally fast without any problems. They have to make sure that they eat a balanced meal at the time of sahur and iftar. This meal should include complex carbohydrates, fruits, vegetables, as well as proteins. They should drink plenty of liquids, mainly water, at the time of sahur and iftar, and they should watch their sugars as needed. The second category is of patients who have type 2 diabetes and they take oral medications. This group can also, most of them should be able to fast without any problems. However, they obviously need to discuss this with their treating physician. Some oral medications used to treat diabetes don't cause low blood sugars. This includes the most commonly prescribed medication called metformin or glucophage, medications like DPP-4 inhibitors. Common medications in this group would include Januvia, Saxenda. These medications typically don't cause low sugars. However, there is one group of medication called sulfonylureas, which includes medications like glyburide, glipizide, or glimepiride. These medications are known to cause low blood sugars. So if a patient with type 2 diabetes is going to fast, these medications either will have to be stopped or their dose may need to be reduced. The third category of patients with type 2 diabetes are those who, after many years of diabetes, are now taking shots, which may include insulin shots or certain other kind of shots. Now, these patients may or may not be able to fast depending on how well controlled their diabetes is, if they are experiencing high sugars or low sugars. Some of these patients may be able to fast, although the dose of insulin may need to be adjusted, whereas other patients who are uncontrolled, they should not fast. Any patient with diabetes who does fast, they should, be watching their sugars. They should check their sugar multiple times a day. I would say at least 4 to 5 times a day during their fast, as well as during sahur and iftar, to make sure the sugars are not too high or too low. They should also be watchful for any symptoms for low blood sugars, which may include sweating, palpitations like heart racing too fast, confusion. And if they do develop those symptoms, they should check their sugars immediately, or they can actually go ahead and eat something and break their fast. Our deen puts a lot of stress that our life and our health is important, and we should never put it at risk. Now, also when they are testing their sugars, if their sugars drop below 60 or it goes above 300, in these two situations, they should go ahead and break their fast. Below 60 means their sugars are trending too low and they have a high risk of the sugars dropping even lower, so they should not take any chances. Above 300 means for some reason their sugars are going too high and it may not be safe to continue fasting. Patients with diabetes, as far as their activity is concerned during Ramadan, they can continue their regular activity, walking or whatever activity they do at work. However, I would not recommend strenuous exercise like going to a gym during the month of Ramadan, because exercise again can cause high or low sugars in a patient with diabetes. They can offer Taraweeh, but during Taraweeh, given that there is prolonged standing, they should make sure that they have water or some fluid with them to keep themselves hydrated, and also they should carry some snacks, and if they do feel like their sugars are dropping too low, they can go ahead and eat something. Again, these are some general recommendations. I would strongly advise that patients who want to fast and they have diabetes, that they discuss this with their individual physicians and follow their recommendations. I hope that in this short video you were able to learn a few things about Ramadan and diabetes. Assalamu alaikum.